So really want to welcome everyone to this webinar on the intersection of subsidy and quality in school-age care. My name is Kathy Schleier, and I am your host today. And I just want to let you know how thrilled we are at the interest in this webinar. I mean, so far there's about 100 or so folks online, and we're expecting more people to be joining us as we sort of move along a little bit. So I just wanted to say a little bit about who's online. I mean, we have representation from folks from Maine all the way to Alaska and Hawaii. We've got many of our Indian tribes and nations and some of our territory folks as well. And within that broad geographic group, we've got our state agency folks who are helping support the families with subsidies, the Child Care and Development Fund subsidies, which is the focus of what we're talking about today. We've got folks on board who are part of state and local education agencies. We have licensors and licensing staff, those who are involved in providing technical assistance, such as folks associated with child care and referral resource and referral agencies and other national and local TA providers as well. We've seen that there's signups from after-school program staff, tribal staff, territory staff, many from after-school networks, and we have providers, community providers of after-school such as YMCAs. So we're really thrilled to see that we've got such a big group of those who are interested in supporting after school, whether you're working at the local, the state, the regional, or the national level, and anyone at all who's interested in today's topic. So just also want to give a little reminder about what Kate has said, that we will be recording this. We are recording the webinar, so it will be available to you for download or sharing with your colleagues. So today we have two presenters with us. I will be passing it off to Susan O'Connor and Bob Frein. Susan has been working in support of the after-school field for many, many years, and you may know of her as a specialist in the areas of quality improvement. She's worked along in professional development and knows a great deal about summer learning. So we're really happy to have Susan with us today. And in addition to that, Bob Frein is with us. Bob works with NCASE, but he's also partners at the Subsidy Innovation and Accountability National Center. So if you are lucky enough to work with Bob or know Bob, you know that he is both dedicated to this topic and he provides a wealth of information on all things that are related to subsidy. So I'm going to move ahead to the start of our webinar and talk a little bit about what our goals are for today. So throughout this webinar, we are going to be focusing on the elements that are important to NCASE. So a little bit about NCASE if you're not familiar with us. We are one of the newest national centers that is part of a larger group of TA centers supporting those who are working in early childhood and after school. And our charge really is to make sure that all children have access both to high-quality experiences in after-school time and summertime, really no matter where they live. And we are focusing on serving low-income children to help make sure that they are gaining access to programs that are both offering high-quality learning experiences and are getting supportive relationships. And we are able to do this work sort of through our partnerships. So one of the things that we like to share is this diagram that shows where we are situated. So you see this bold red arrow that's over on the right, and that's the name of our center, the National Center on Afterschool and Summer Enrichment. So what this represents, this diagram, if you're looking sort of left to right, is the whole continuum of ages from birth all the way through 13 and beyond. So in partnership with our other centers, we are helping to serve families and stay family-focused and child-focused through professional development, provision of subsidies, et cetera. So you'll see this all funnels down to a arrow that says resources. And as Kate mentioned when she first welcomed us, is that we are very excited to tell you today, as we've launched our library. So NCASE has been sort of hard at work building what we call sort of a comprehensive library of resources that is meant to support all of you who are working either at the system, the state level, on after school. And this library is really, it's open to anyone. It's free and it's open to the public. And it will be growing over time with a wealth of articles, recorded webinars, toolkits, other items. But we are really happy to announce that this library is live as of today, and asking you to be on the lookout for an announcement next week that will give you more details about how to access that library. And also, as we mentioned earlier, in the pod that's called Web Links down below, you'll find the URL for this library, and you can access it at, after the webinar, not during our webinar, after the webinar. So the other thing I wanted to say is this webinar that we are presenting today, when we record it, we will make it available on the library site for anyone who is interested in listening again or sharing it with your colleagues. So what are our goals for today? Today, our overall goal is to think about how we can better serve more children in higher quality settings. So we're going to explore this idea and ways to get there. So of course we want to look at this, what we've been calling sort of the continuum of time and place, so that we are making sure that children are served, whether it be in the summer or whether it be in the school year, anytime they're out of school time, experiences that we're capturing them sort of everywhere in high quality settings. And that we do this sort of from their early childhood years all the way through school age. So we really want to learn today and share a lot of ideas about how subsidy spending can support quality improvement in school age and how we can be sort of family and child focused. So one of the things that I want to make sure of as we're talking is we try to not use too many acronyms, but or things that are not so clearly understood. But we thought it would be helpful to start with a few working definitions. And in particular, already you've heard me say the word school age, you've heard me talk about out of school time, and you've heard me talk about sort of after school and summer. So let's just look at those definitions for a minute. So for the purpose of our center, we say that school age care refers to the age of children that's being served. So for instance, school age is the years and the ages and times that children and youth are in school, and the continuum in addition to that would be infant, toddler, preschool care. So school age is the years and ages of when they're in school. Out of school time refers to that programming that happens outside the school day. So that can be before school, it can be after school, it could be on summer, vacations, weekends, and of course it can be in different settings. So it could be at family-based care and or center-based care or camps. So then our center name, we are the National Center on Afterschool and Summer Enrichment, and so we use this name sort of interchangeably with out of school time. So we will try not to, as I mentioned, we'll sort of try not to use too many acronyms, and if we do, we'll put them in the chat box to make them understood by everyone. If we mention an acronym or we miss defining one, please feel free to type into the chat box and ask your question and ask it to be explained so that we can make ourselves clear to you. And later in the poll, or later in the webinar, we will be doing some polls, and so we really are wanting and hoping that we're going to get you to participate in that, and there are also going to be some opportunities for discussion. And then at the very end of the webinar, we are going to launch a very short, I promise you it's very, very short, evaluation that we really hope that you will complete so that we can get feedback on this webinar. So with that in mind, I'm going to turn this over to my colleague, Bob Frein. Go ahead, Bob.
Thank you very much, Kathy, and welcome everyone. I just want to say it's a privilege to be part of this webinar. I'm the TA lead for the National Center for Subsidy, Innovation, and Accountability, and we're a partner with the National Center for Afterschool and Summer Enrichment, and it has been great working with the NCASE team on a variety of different projects, including this one. The intersection of subsidy and quality is something that's really near and dear to my heart because I really see subsidy and quality as being inseparable. And I learned that from being a child care provider for 13 years, where I was in charge of a program for infants through school age, and also being in charge of subsidy for the Commonwealth of Pennsylvania for 11 years. And then also working as a TA lead for the Subsidy Center. And so I've always said that subsidy and quality are two sides of the same coin, that they are inseparable. And so today, the agenda, we're just going to focus on some of the key points because we can't cover everything, but some of those key points that we're going to look at is recognizing and improving quality, which is so essential, supporting family-friendly policies, supporting provider-friendly policies, developing indicators of success, and exploring levers of change. What we really want to do is focus on these steps because they're essential to supporting out-of-school time or school-age care. And so that will help frame our discussion for today. And so when we talk about recognizing and improving quality, one of the ways that we try to do that is looking at the number of school-age children in subsidized high-quality settings. More and more school-age children are being enrolled and are in high-quality settings, which all the research shows has a real impact on not just school performance, but also a variety of other factors. And so it's really important because one of the largest groups of children served by CCDF funds are school-age children, which is something that a lot of people may not be aware of. And so that's really important. There's always so much emphasis on infant, toddler, and preschool that sometimes school age gets forgotten or isn't considered part of the mix, and that's really important. So it's really essential to be able to get more and more children in high-quality settings, especially school-age children. Another thing that isn't always looked at is the need for providers to reach greater financial stability. For those of you that are child care providers, and I was one, it is not a very lucrative business, and most of us literally existed on the margins for many reasons. The high cost of care, turnover rates, a variety of different reasons. But one of the things that we've learned through the research is that if providers have financial stability and have the ability to invest their funds, it will really pay dividends for children of all ages, including school-age children. And then also, more and more focus has been on the better alignment of state policies that are provider and family-friendly in order to improve quality, have the continuity of care that is needed, have partnerships with providers in a variety of ways, because there is a real need to have sensitivity to parent schedules and provider schedules, to varying school-age schedules, to accommodating the specific needs of summer care for school-age children, closed days, and a variety of other factors. And so those are just some of the ways in which we're really trying to align subsidy and quality as it relates to school-age children. And that fits in really closely with some of the themes that I talked about before, about family-friendly policies, provider-friendly, as well as quality, which are key components of reauthorization, otherwise known as the Child Care Development Block Grant or the CCDBG Act of 2014, which in many ways really emphasizes the importance of high-quality care for all children, but especially low-income children, with some of the goals to serve more low-income children and more low-income children in high-quality settings. And this new rule, in a powerful way, shows the importance of quality and has really moved childcare, I think, in a powerful new direction that is going to be transformative in many ways. And just some of the major goals is that it establishes a dual purpose of the program: work support and child development. The child care subsidy program used to mainly be a work support program where you would go in and you would only be authorized or be allowed to have care for the hours that were attached to work, to education, or to job training, and no other time was allotted. And so it was really more of a work support rather than really tying it into, yes, support for work, but also child development, so that the children in the program really got the benefits of a comprehensive full day, very highly trained staff, excellent curriculum, and ways to support them so that they could be very, very successful. And I think, this new act in a powerful way really makes this a goal. Secondly, it's a multi-generational approach, which is something that I think is really important. In the past, things were mainly child-focused. Now it's both the child and the family in order to be able to provide the benefits that the child needs in care, but also to help families become self-sufficient and be able to move forward. So the whole idea is to assist the whole family with a variety of supports and kind of break the cycles of dependence and be able to help people to grow and flourish to their full potential. And of course, the emphasis on the quality and continuity of care. Just a couple ways in which the new law does this is moving to a minimum of at least 12-month eligibility for subsidy families, a period of job search so that, again, families can continue in care after they've lost a job or their training or job search program ends. The emphasis on ensuring equal access so that all families can go and be able to participate in high-quality settings. And so those are very important points, all to basically help children succeed. And especially with school age, I think all of these things will help with the fade-out effect. And I think also by having children in these comprehensive programs, including school-age children, there's what's called the ripple effect, which really influences and benefits all children. And so a variety of ways in which the vision of the Office of Child Care is really transformative and is going to impact all children, especially school-age children, as we move forward. And now I'd like to turn it over to Susan, I think.
Yes, Bob, thank you so much. And I couldn't agree with you more about quality and subsidy being inseparable. I, too, feel excited about the potential of the new CCDDG Act and helping us to move forward in a way that's going to improve quality for children, support families, and also have provider-friendly policies that can help us move the needle. I want to start right now just with a bit of a focus on quality and what's at stake in advancing quality in after-school and summer programs. Deborah Van Zel, a top researcher
I was going to email
on the
her and see if I can help them get it set up via webinar. Because really, they needed to do a tech check 2 weeks ago if they're going to do a webinar.
Okay, I think someone has not.
I'm sorry, Susan. 1 second. Let me reset the system.
To know that.
You are no longer muted. You can unmute your line by pressing *6.
Hi, everyone. Sorry about that. We're going to keep going. Susan, do you want to go ahead and just hit *6 and you'll be good to go?
Deborah Zendel, a top researcher on after-school and summer programs, says that high-quality out-of-school time programs are essential to the learning process because they provide young people with opportunities to relate to the world in a new way and can foster an orientation toward lifelong learning. Zendel has created a list of key characteristics of high-quality programs through her research. These are going to be familiar to you, but I want to go through them one at a time because I think that you will see that there are direct ways in which we can honor the importance of these quality features in the way in which we structure our subsidy policy. Positive relationships between youth and staff are at the top of the list, immediately followed by positive relationships among program participants, then appropriate levels of structure that include a focus on voice and choice so that we're really tapping into what we know about motivation for learning that can in turn lead to high levels of student engagement in both academic and developmental skill-building activities. Zendel's research of programs with these features show that high-quality programs can produce positive social and behavioral outcomes as well as academic outcomes. So continuing then, the early childhood investment ensuring school success, ensuring positive developmental outcomes. I wouldn't be complete in my talk about quality without pointing out a special note about summer. Participation in high-quality summer programs alone can make the difference between adding to the achievement gap or helping to close that gap for children who are lower income. So we've got to always keep a special eye on how our subsidy policies impact access to summer programs. Now, as we all know, there is a broad range in the quality that is out there. Many programs are struggling to advance quality due to some challenges which confront early childhood and also some challenges that are more unique to the school-age field. States are at varying stages of success in addressing these challenges, and the challenges, of course, include financing strategies to meet the true cost of quality. Moving the focus into continuous quality improvement where we're involving staff, families, and youth in change that can last. Providing systemic supports for the full range of staff, including the large portion of the school-age and summer field that are part-time and temporary, all the way up to those program leaders that are so essential to guiding quality improvement and setting a foundation of strong structural quality. Improving recruitment and retention of staff, given that turnover can be an annual average of 40%, which is definitely higher than that in the early childhood field. Addressing summer quality, and then last but not least, working to unify the field and share resources and ideas across sectors. That includes CCDBG-funded programs, 21st century programs, family child care programs, and youth development programs to reduce the fragmentation that we experience and to really help use our joint funding to leverage higher quality. The system building efforts that we want to see happening include quality rating and improvement systems, which are the focal point for quality improvement in the early childhood field, especially for those 20 states that received Race to the Top Early Learning Challenge grants. However, when we stop and take a look at the numbers, many states still do not have QRIS for school-age programs. Some are just starting to pilot those systems. And then there are also the ones that started years ago, including school-age childcare, but still are finding it challenging to increase the participation of school-age programs. This can be attributed to a lack of funding to fully expand QIS to school age at the state policy level. But I think a lot of people out there are feeling there's also a hesitation among school age providers to participate. And that has included some discussion about the readiness of the field for high stakes ratings that can impact reimbursement. So now we're going to talk a bit about family-friendly policies, and Bob has mentioned some of these. I'm going to go into a little more detail. The CCDBG reauthorization includes some changes to policies that are specifically to be supportive of families. I want to mention a very helpful resource that is put down in the web links bar. It is done by the Center for Law and Social Policy. It is a guide for states on the child care development and block grant reauthorization, and the link starts out with the word implementing. The guide reviews the changes that are being made in CCDBG and has this to say about the reauthorization. The reauthorization includes important subsidy policy changes designed to reduce burdens for families trying to get and keep child care assistance. By minimizing reporting requirements and complexity that can result in families unduly losing their assistance, these improvements will help families have the stable, continuous child care that parents need to succeed on the job and that children need for their healthy development. So we've identified some specific family-friendly policies to consider for school age. Number one, ensure that your market rate survey reflects the needs of school-age programs. So let me just pause a minute and not assume that everybody is familiar with market rate surveys.
Susan, I'm sorry, 1 second. I'm not quite sure what happened, but we are hearing music.
You are no longer muted. All guests have been muted. You can unmute your line by pressing *6.
Susan, go ahead. I'm not quite sure why we're having some audio issues, but please do proceed by unmuting yourself.
Sure. So thanks for hanging in there with us, everyone. I want to start again on the market rate surveys and not assume that everybody is familiar with market rate surveys. States have to conduct a survey or an alternate methodology every 3 years. The purpose of the survey is for states to see where subsidy payment rates compare to the private market to make sure that they're setting payment rates at a place that will help to ensure equal access to child care for those families that can't pay for child care without support. The surveys take a look at the variations in the price of child care services by geographic area, by type of provider, by age of the child. And of course, the point of these is to also move our payment rates toward the true cost of quality. The class guide points out that as of 2014, 37 states have child care assistance systems that provide higher reimbursement rates to child care providers that meet specific quality requirements, usually through QIS systems. Despite these efforts to incentivize care through tiered and varying rates, most states still do not have rates that reach the federally recommended rate, which is 75th percentile of the market rate, even at the highest tiers of tiered reimbursement. So as we move closer, and I know states are working hard on this, as we move closer to rates that are 75% of market, and we increase the investment in quality, we are going to really need to focus on getting more funds to both focus on quality and to maintain current access to care. So this is a bit of a challenge that is facing us in the years ahead, but one I think that we're all very committed to. The second family-friendly policy I want to talk about is supporting quality school-age care through consistent rate structure and for differentiated school-age rates. And the reason that we need to do this in school-age is because we often have, for funding, after-school programs or before and after-school programs. So those programs might be open 3 hours a day. They might be open 4 or 5 hours a day. But then we have the full days of school vacation weeks and summer where we might be open 8 to 10 hours a day. So schedules for school-age programming are going to vary by the school calendar and also be impacted by weather, by school events that will all impact the need for care. And so it's really important that as we look at setting rates for school age, that we take into account this varying number of hours that we're open. There are 3 strategies that you might want to consider using in order to really differentiate your rates for school age. The first is offering a blended rate. These ideas, these examples are captured in the second resource in your web link bar, Spotlight on Quality. A blended rate provides consistent and predictable subsidy reimbursement by blending part-time rates for the school year with a full-time rate for summer and other school vacations so that we're clearly recognizing the difference in the number of hours that school-age programs are open. The second option is providing a consistent full-time rate that may be, say, 45 hours a month, and you get a reimbursement per child 45 hours a month, September, October, November, but also in June, July, August when they're there for summer programs, but so that programs can predict monthly what their income is going to be from subsidy. A third option is to have an automatic approach to paying programs when schools are closed, for example, parent-teacher conferences, snow days, or other weather issues, where automatically there are states that just have a system set up where you can notify them that maybe you had a snow day and you can automatically get paid to cover the care that you hadn't necessarily anticipated providing. Okay, and there are 3 additional strategies here for family-friendly policies that I want to go over. The next one is setting affordable copays for families. The legislation does not specify how states are going to design copayment policies, but this is certainly a great time for states to re-examine copayments while many other changes are happening. The class
Susan, I'd like to add that OCC has recommended a benchmark of no more than 7% of a family's income to be part of a copay. So I thought I would just throw that out and tag team with you on that one.
Thanks so much, Bob. Yeah, I think that there's also some indication from other sources that making sure that we keep it to 7% of their income, which is about what families pay who are paying for care. But also with the idea that those families that are under the poverty line, we're probably going to need to think differently about those families that are really struggling month to month to make ends meet.
And states have the ability to waive copays for any families that are below federal poverty guidelines, and more than a few states do that as a way to be able to support the lowest income families so that they can afford care, including high quality care.
Thank you. Next is improving the continuity of care, and I know that there's been a lot more focus on continuity of care for early childhood, and particularly for infant toddler care as it should be. But given what we know from the research, that continuous and positive relationships between staff and children is a cornerstone for quality for our age group and for achieving child outcomes, we really want to take a look at what we can do to ensure continuity of care. And there are several CCDBG policies that are going to help us improve continuity of care. And Bob mentioned these before, but I want to just go into a little bit of detail. Once a child has been determined to be eligible for child care assistance, states have to consider the child eligible for a minimum of 12 months, regardless of temporary changes in a parent's work, education, or training activities, as long as their income doesn't exceed 85% of the state median income. One study of 31 states showed that the number of months of subsidy actually was averaging 4 to 8 months. So often the way subsidy payments were set up, often families dropped off of subsidy far sooner than we would want to see them. Certainly, it's going to be important to provide continuity at least through the school year for children. So the new policy of having redetermination only every 12 months is going to go a long way to really helping reach the potential that our staff-child relationships can have, because after all, we could see a child from age 5 all the way up to age 13, and before school and after school and summer. We might also have their siblings. We get to know their families, and these policies that can protect the potential of these relationships are so important for us in our age group. States are also working on ways to be more user-friendly for families by providing multiple ways for families to apply for subsidies, reducing the need for in-person visits, which can be very hard on working parents who have a job or they're in training programs. They have maybe several children. Maybe they lack transportation resources. So instead, there is more of a movement to having them apply or reapply electronically, by mail, by phone. And some states are even providing a unified application for child care subsidy, for SNAP, for TANF, so that families are only filling out one application instead of multiple applications. Some states are also working to increase access to after school, and sometimes with a special focus on summer slots where there is a high concentration of poverty, unemployment, or for children who are homeless or in foster care, and maybe looking at the possibility of contracts as a strategy to help increase high quality care for those targeted populations. The final point I want to make is that we want to make sure we're adopting schedules that reflect working family needs, that are before school starts when parents need to be on the road to their jobs. Our after school ends with enough time at the end of their workday for parents to wrap up work and arrive in time for pickup. For schedules that allow flexibility and participation so that children can participate in sports, scouts, music lessons, or alternate summer activities. After all, these kinds of opportunities connect the children in our care to community activities and to give them the chance to build hobbies and skills that are important for any school-age child. So really figuring out how we can be flexible to allow for some change in attendance for those other activities. And finally, is there a provision for families who need care during non-traditional hours? For lower-income families, it is more common for them to be working second and third shift, or even more so for those whose work schedules are changeable. So how is it that we can provide services for families that do struggle with those varying work schedules. And now, we are very interested in hearing from you. And this is your chance to weigh in on what kind of family-friendly policies you have. What we want you to do is take a look at this list and identify which family-friendly policies, to your knowledge, exist in your state. And you can check more than one, but this is going to give us a wonderful chance. We have about 150 people on the line now, and as Kathy said, from a variety of states, from a variety of roles and jobs in the field, and it's going to give us a great chance to take a look at what kind of family-friendly policies exist in your state. I'm going to give it another minute to give a chance for everybody to access the poll. Okay, let's take a look at what we've got. It looks like the top vote getter is multiple ways for families to apply for subsidy, more than just that in-person visit. Next is full-age contracts or grants with providers where there is a high concentration of low-income families. Really trying to use contracts and grants to stimulate service for those children and in those places that especially need it. Next in line are two items: customer service for family support and non-traditional hour care. Then quick access for children who are in foster care or who are homeless, followed by the last three items on our list: flexibility in attendance, increased funding for summer slots, and we have some in the other category. Okay, we have another chance here for you to weigh in. And what we want to ask next is this question: what are the challenges of supporting family-friendly policies in your state? And we're going to be silent for a minute while you type your answers in, and then we'll start taking a look at what's coming in on those challenges that you're facing. Okay, we have a consensus building here so far: lack of funding, reduction of funding. And I see that while people are filling this out, Susan Warba asked a question in the chat bar: do we know what's happening for families who are new immigrants, new Americans? And Claudette right away answered limited funding. But if there are people out there that have been able to develop strategies for new immigrants, it could be great for you to weigh in about your strategy in the chat bar. Okay, there's a response here that there's focus is on early childhood. There's a challenge with staffing and funding. Provider licensure. That is certainly a big one for after school. We have a lot of legally license exempt programs. We're going to be doing learning community focus August 17th on license exempt programs. So know that's an issue for many of you. Taking too long for quality child care approval, okay, and the legislature. Okay, thanks so much for pointing out what is the central challenge to family-friendly policies, and that is funding. I think it's what I said before. We have a challenge before us. We want family-friendly policies. We want high quality. We want access. And that is, points to the dollar sign. So thank you so much for your input. And now I want to pass this back to Bob.
Thank you very much, Susan. We've talked a lot about family-friendly policies. Now we're going to talk a little bit about some provider-friendly policies in a variety of different ways. I skipped one here. We have a list of those, and the first one is tiered payments, but one of the things that I want to focus on is that in many states the base rates are extraordinarily low, and that in many respects, based upon market rate surveys, it's going to be very important to ensure equal access for states to really look at raising their base rates for subsidized child care, but then also have the tiered payments, which is an add-on for those children who are in a high-quality program. Many states have a quality rating and improvement system with a star rating or some other type of rating where a child will get a tiered payment or add-on amount in order to have providers take more subsidy kids in order to be able to provide the greatest amount of access and supply building as possible. So that's one way to be provider friendly and rewarding providers to serve school-age subsidy children. There used to be 4 set-asides for those of you who are as old as I am, and one of those actually was a school-age set-aside. Now there's really only 2 set-asides. There's the 3% infant toddler quality set-aside, and then there's an overall quality set-aside that is now at 4%, but based upon the CCDBG Act of 2014 will move to 9% over time. And with most states having the largest percentage of children in subsidy programs, in school-age programs, there are creative ways to be able to use quality set-aside dollars in order to reward providers for taking subsidy kids. And there's a variety of strategies that states can take in being able to do that. And so a lot of times, again, there's the emphasis on a particular age group, and sometimes school age is not the central focus. And in reality, all age groups should be looked at and dollars allocated in ways that target those to best meet the needs of children. Another really important provider-friendly policy, and it's a great incentive, is to look at enrollment authorizations for quality, that there are incentives for having low-income families who are subsidy eligible be able to choose high-quality programs. Sometimes they can have a reduced copay. There's a variety of other benefit incentives that are attached to that. And of course, one of the things that's most important is that providers need to be paid on enrollment rather than by attendance in order to be able to have a stable income stream and be able to provide those comprehensive services that are needed. Another very important provider-friendly policy that more and more states are using is grants and contracts. States are using grants and contracts in a variety of ways to serve a specific population, possibly school-age kids in an underserved population, an underserved area, maybe in an area where there's a great need, but there's not enough providers providing school-age care because there's no transportation. But grants and contracts give states the ultimate flexibility to be able to target dollars to a specific need and to a specific age group. And there has been some very creative use of grants and contracts in order to build supply and increase access, including for school-age children. And it's important for summer programs. A lot of times people think, oh, school age, well, it's the 9-month program. There's a before and after school program. But what happens during those transitions? Are there policies that really allow children to go during the summer and have the adequate reimbursement rates for that full-time care? Is there a continuity of care between the part-time during the school year going to full-time during the summer? Or even more important, at times there are many families that do not need care during the school year, but they need care during the summer. And when they apply, there may be a waiting list or there may not be funds available for them. And so some states have allowed for set-aside so that they have a special pool of dollars for summer care so that children can bypass the wait list. There are times when they will allow for suspension of services so that kids will be eligible during that 90-day period. There are some states that will actually have a special grant program with extra dollars for increased slots for summer programs. Massachusetts is one state that has one, and there are other states that look at creative ways to do that. So again, I think the several-pronged approach of having family-friendly, provider-friendly approaches is very important in order to be able to meet the needs of children, the needs of families, but also have access to providers who will be willing to take subsidy children and have those subsidy children be in the highest quality care possible, especially in those types of school-age programs. So that's really, really important to be able to look at. As we go to the next slide, which kind of goes a little bit deeper, is to look at authorization or enrollment practices. One of my favorite lines is that as part of reauthorization, when we're talking about a minimum of 12 months of eligibility, 12 months of eligibility or enrollment means 12 months of authorization. And so children really should be eligible for that full 12-month time period. Again, there's a movement that you're not paying based upon just the hours of care that are needed, i.e. the work support program that we talked about before, but work support and child development so that you're really providing comprehensive services so that all children get the full benefits of a high-quality program. And we also know that many families have what I call the Walmart schedules. They don't have the 8-to-5 jobs. They have jobs that sometimes are second and third shift. They have varying hours and varying schedules, and sometimes providers and families can get nickeled and dimed. And so a lot of times it's really important to just provide the care and have that flexibility so that providers can take care of the children based upon the needs of the family, but also provide those comprehensive services without it being tied exclusively to hours of care, i.e. the multi-generational program and a child, not just work support, but also a child development program. There's a real need to take into account transportation, and so a lot of states will allow for a certain period of time before care and after care in order to be able to pick the child up, and that counts as hours of care. And then if it's an extended period of time, as long as there's a valid excuse, they will allow that to occur. So those are the types of things that need to be that need to be taken into account. Of course, when I always think of transportation, I always think of when I was a child care director, and for those of you who have been providers, you know that you cook and you clean, and if you have a school-age program, you drive the van or the bus, and I drove the van or the bus on more than one occasion, on more occasions that I could remember, and I so enjoyed that, and I always tell people if I ever wrote a book based upon the stories that I heard kids tell in that van, I would probably be very rich. It was a real treasure to hear the school-age kids talk about all the different stories as if there was no adult driving, and so that was a really rich experience. And then the delinking work schedules really is a summary of the two things that I talked about before. Again, providing care for the child in a fully comprehensive way for the full day or for the full time before and after school as needed without tying it exclusively to a very stringent work schedule. Again, and payment practices for providers, it's so essential. There are people that pay, by the hour, which really is difficult for providers because if a family's there 4 hours one day and 6 hours there the next day, it changes back and forth. So do you really pay by enrollment? So you either pay by full-time or by part-time or based upon the need for comprehensive services. And so that's a really important point because providers need a stable source of income, and that source of income is so important for them to be able to invest the dollars in order to be able to meet the needs of children as well as provide those services. And then the timeliness and ease of payments. It would be great if in the subsidy world more and more states paid prospectively. I believe there are 2 states that pay prospectively right now. The rest pay well after the fact, which is very different than the private market and can cause cash flow issues. But I think the timeliness and ease of payments for providers is really essential and something that the new rule really tries to emphasize and look at as a way to say, hey, the subsidy market should mirror the private market and families should not be disadvantaged, nor should providers, and that we should all have an equal and level playing field. So I think those are really, really important points to be able to look at and to emphasize. So we're just kind of going over some of these things in general without getting into too many specifics, but I think the overview is really helpful to cover the big issues, and then in time there could be the opportunity for a deeper dive or further questions as time goes on. So now I will hand it back over to Susan or Kathy.
Thanks, Bob. So, whoops, I'm sorry. So we both clicked the advance at the same time. So now I'm going to go back one slide. So to wrap up our discussion element on provider-friendly policies, again, we're really interested in hearing from all of you on the line. So one thing we've been thinking about, Bob presented a lot of strategies and Susan presented a lot of strategies. But before we sort of get to our poll, I just wanted to point you to this quote that we've sort of embedded before that, and I was just going to read it to you. And it says, expanded investments are essential to allow parents to have the affordable, reliable child care that they need to work, and children to have the early learning opportunities that encourage their successful development, and our nation to have the strong workforce it needs to prosper and grow. We really like that quote, and we really are hoping that it resonates with you as we sort of think about what things we can put in place to, work harder to be friendly both to our providers and to, stay focused on children and family. So thank you for going ahead and answering the poll, and let's sort of see where our results are. So Bob talked about a lot of provider-friendly policies, and I'm really interested to see what policies are happening in your states. And for those of you, so sort of a small number of you, but for those of you who click Other, I would love you to put your other policies into the chat box so that we can learn from you. It would be interesting to know what other ideas and strategies are out there besides the ones that we've identified? So, and I'm glad to see someone's typing to answer that question. And interestingly enough, we can see as it goes on that that access to tiered payments, or as Bob has said, what we might call add-ons, is the highest number of things that folks are doing in their states. And it's nice to see that some states, about, certain percentage are moving to make adjustments so that their providers can get paid in a timely and an easy way. That's wonderful to hear, because everyone knows that the paperwork is a lot and the demands are a lot for doing this, and the programs need the money in a timely way to be able to pay their staff, et cetera. So that's really critical for programs. And let's see, here's one of our other comments. So state recognition and support for quality standards. Oh, that's wonderful. So for instance, if I'm trying to sort of understand this, but as Washington State, I believe they have quality standards, and that so if folks are maybe reaching those quality standards or using those quality standards, then they're getting some recognition. And maybe Teresa will sort of chime in a bit more to tell us a little bit more about that. So let's examine some of the things that, and it's interesting to me to see that as folks are answering this, besides the first one, the access to the tiered payment and the timely and ease of payments, most of the others are right at about the same rate. So that means, of course, that folks are using a variety of strategies, but they're sort of being creative, as Bob just talked about, with the grants and contracts. And folks are moving to cover payments at the times when schools may be closed, et cetera. So that is all good to see. Okay, well, thank you, Kate. I think we are good for...
Kathy, I'd just like to add one more thing before we go on here. This is Susan, and one thing that I'm noticing here on this poll and also the previous poll is that we have about 150 people on the webinar, but only 25 respondents really, even for the biggest response, which is tiered reimbursement. So I'm taking that to mean that probably some of you who are participating don't know what your subsidy policies are. And this, webinar gives you an idea of some of the things that you may want to be considering, and certainly providers that you may know are going to be able to talk to you about it, or if you have direct connection into your CCDF agency, to begin asking, because these things are being looked at now, and really trying to understand what things are being considered in your state and which things might be the most helpful for families, for providers. Now's the time to be understanding about that. So I think, Kathy, that's part of the story here with the responses, the number of people that have responded. So thank you.
And that's a good point, Susan, and I would point out to everybody that every state has a state plan, and in the state plan it really outlines in detail the different subsidy policies. And so if you're not aware of some of the family-friendly or provider policies in your state, you can get a copy of that state plan, which is what a state does to outline how they're going to implement and use their CCDF dollars over the next 3 years. And it is a very detailed plan, and it's very important for people to be familiar with that so you understand what your state is doing and what it is planning to do during this time of transition.
All great points. I really appreciate that, because I think the other thing that we want to point to that we've sort of alluded to is that the set aside for quality is going to be sort of increasing over the next few years. So now is a really good time to be looking at what ideas are available and, bringing your stakeholders together to talk about school age and to make sure that school age is getting, its share of that money going forward, or as best it can, to contribute to more quality in school age. So these are all really helpful points. One thing I've noticed is that many folks are talking about standards, quality standards that they're implementing or that they've developed for their states. So it's wonderful to see that states are taking that action to enumerate and identify what's unique about school age and then define what that means for quality in their state and then make that available to programs to give them some awareness and understanding of how to reach quality and what that takes. So, and thank you. We've got the information in the chat bar about how you can reach the state plans. So there you go. You've got lots of reading ahead of you, but I think that's really important for everyone to be familiar with their state plans, and now that they're published and available, it makes it easy for folks to do that. So one of the things we thought we'd do is take another minute and spend a little bit of time answering this next question about what are the challenges of supporting provider-friendly policies in your state. And when you think about that, not just thinking about the challenges, but maybe also thinking about and considering what strategies that you're enlisting to overcome some of these challenges. So maybe we can put the challenges into the answer box, and then over in the chat bar, sort of think about if you see some challenges that arise there, but your state has addressed it. What strategies have you used to address those challenges? And I see folks are typing, so we'll give you a minute there to spend a little bit of time. Okay, putting in your challenges. Challenges for providers. Maintaining, all right, so some of the things that are coming up is fraud and fraud, or needing fraud prevention. And so interestingly enough, cultural expectation and political climate. So somewhere in the chat bar, someone had mentioned, the difficulty in knowledge, and so sort of helping folks understand, the need for supporting providers and helping, all the folks that need that support, including those that maybe need English as a second language or immigrants, et cetera. So we want to make sure that we can try to address that that big need. It's a big need and very important, so I'm really glad that that's been shared with us. So there's one specific question about, is there subsidized funding available for exempt child providers in Texas? And so that there is subsidized funding available, but I'm not off. I personally, I think I would need some help to look up Texas in particular to see how they handle exemptions. And
there's one here also, Kathy, untimely payments, that it takes 3 weeks to get payments. I'm wondering if Bob has a sense of what the average payment cycle is.
The average payment cycle generally for most states would be, for example, let's just take the month of July. So providers would either send in electronically or by paper their invoice and attendance for the month of July by, let's just say, the 5th or 6th of August, and if they got that in on time, they would probably be paid near the end of August. So there's usually there's usually at least a 3 to 4 week time period, although there are some states that will pay twice a month, so they'll pay the 15th and the last day of the month. But there are a majority of states that wait for that invoice to come in, and it takes them about 3 weeks in order to be able to do all of that. And then again, there are several states that will pay prospectively. So states are in a variety of places in connection with that, but with the majority, definitely the vast majority, paying after the fact, and some well after the fact. And I do believe that there is subsidized care for exempt providers in Texas, as long as they have a provider agreement.
Okay, thank you. So we see, overall, there are many challenges. Some are very sort of specific on the ground at sort of the program level of fraud, and some are, raise all the way to the top about, sort of state issues. So each of these kinds of needs its own strategy, and we, in particular, this is helpful to us because we can now sort of think about planning more information that we can get to folks in our future events to address some of these things and to help folks get the answer. One of the things I wanted to say is, one of the things I noticed is getting information out to families. And so that's where, we're grateful for all the TA providers and for the child care resource and referral agencies, because, that's a constant activity that needs to be done as new families move in, and particularly families that may not be as familiar with working with the system, and so reaching those families.
And Kathy, I'd just like to add to the fraud case, our center, the Center on Subsidy, Innovation, and Accountability, handles the improper payments reports that the states have to do every 3 years, but we also work very closely on waste, fraud, and abuse, and helping states increase program integrity and deal with mitigation issues. And so we provide a lot of technical assistance in order to be able to assist states in being able to make sure that they're using their funds as wisely as possible and targeting the funds to those that need it the most, and helping to work with states as well as with different lead agencies on how to deal with fraud, waste, and abuse, and provide the support that's needed. So that's just one of the things that our center does, and going forward, we will be having some program integrity webinars going forward as ways to be able to assist states and assist different agencies in being able to deal with that issue.
Wonderful. Good. All right. So at this moment, I'm going to conclude our discussion on provider-friendly policies so we can move ahead to our next topic. Susan. And I think, Susan, you might be on mute.
Thank you, Kathy. As we head toward wrap-up, I want to just summarize what we believe to be the indicators of success in finding this balance around quality and subsidy, really trying to have these two parts of the coin, as Bob puts it, work together. And I just have to say, underneath this all is really that dance that we are all doing with funding, trying to find that careful balance between access to programs, the quality of programs, and the support of the providers as they serve children and families. And it is always been complicated. At the top of our list, we really want to increase the numbers of children in high-quality out-of-school time programs. If they're not in a quality program, we may not be helping them to achieve the outcomes that are important. And we are definitely struggling with trying to maintain the numbers of children that are served. The class report, the guidelines report that I mentioned before indicate that in 2013, only 1.46 million children were served through CCDBG, which was the lowest since 1997. So the numbers have dropped some for a number of reasons, but in part because we're placing a greater investment in quality. And that about that time, only about 17% of eligible children were receiving assistance. So while we work on raising the quality of programs, we also need to work on maintaining sources of funding for access to these high-quality services. And this really goes to a number of things that came up in the chat bar. It's about the money. When people were asking about refugee assistance, we had 3 states say that they have refugee assistance. That was Delaware, Utah, and Indiana. Indiana saying that they have provisions for refugees to receive immediate child care, which is wonderful. Very important, and again, it's a choice about where funds go. Then someone said, why don't we get targeted school-age quality set-aside dollars? Well, we actually do. We sort of share our piece with child care resource and referral centers. But it always just doesn't feel like it's enough, and certainly we'll need more as we increase the number of programs that are high-quality programs. What are the costs underneath those high-quality programs? Well, it means that we need to create more robust professional development systems, career pathways that include training, credentials, college courses, and then also include technical assistance to help everybody in the field to implement what they've been learning through their professional development. Many states and school-age networks have developed program standards and adopted program assessment tools. It takes time, it takes money to develop these supports to quality. Other states have adopted quality improvement approaches, and they provide incentives for participation, and certainly many states are really focused on developing QRIS for school-age. They might start with developing their QRIS standards. These standards might be standalone, or they might be embedded in early childhood standards. They select program assessment tools. Some states have made QRIS participation mandatory for any program that receives subsidies or other grants from CCDF state agencies. Other states are exploring ways to encourage voluntary participation. But one thing that certainly complicates QRIS participation for school age is the number of licensed exempt programs, given that level 1 is usually 4 licensed programs. And so that in turn often requires an investment so that states can help licensed exempt programs move over into a licensing status, or at the least as required by CCDBG to monitor the license exempt program. So these are all issues that come up and get in the way a bit of us reaching these indicators of success. And we want to go one last time to you to ask you what strategies that you are exploring in your state or that you have thought of could help us reach these goals to increase the number of high-quality out-of-school time providers, increase the number of children in high-quality programs, increase the number of school-age programs in QRIS. So if you can just take this one last chance to weigh in and say, what strategies are you trying? What strategies have you thought about that you think can really help us move forward on these 3 indicators? And we'll give you a minute to answer. Okay, here's one. To assist public schools to meet licensing requirements so that their out-of-school time programs meet minimum standards. This is a huge issue. Many states provide exemptions for programs run in or run by public schools. So providing this support would go a long way to helping us increase quality, ensure basic health and safety, and help to move people into QRIS systems. Assist providers to attain levels of quality. That's critical, really focusing on building the capacity of leaders to guide continuous quality improvement efforts. Okay, there's more on schools here. Involve superintendents of schools to help support the initiative. Absolutely. I think collaboration on every level is going to be a key to moving us forward. Okay, here's one. Mandatory participation in state QRIS, including license-exempt programs, in order to receive CCDF dollars has been effective in increasing QRIS participation. I know that is a big discussion point, whether to keep participation voluntary with incentives or to make it mandatory. Very major discussion. Okay, here's one that I would like to hear a little bit more about. Improve licensing requirements. Move the bottom up a level. So if the person that said that can add a tiny bit more, it would be very helpful. While there's typing going on in the chat bar, here's one. State agency working together to braid 21st century child care and child nutrition dollars together. I think this is huge. These are all public dollars. Finding ways to have those public dollars work together to achieve what we want is, I know, such a promising strategy. Whether it's supporting a more robust professional development system, whether it's finding a way to braid the funding around perhaps resources that are going to be developed and are out there to improve quality. Just even having technical assistance that goes across those sectors would be helpful. So I appreciate that. Okay. All right. I want to just mention before we finish that there are some levers of change that we've referred to as we talked about strategies for change, but there are 3 that I just want to touch on. And the first is that collaboration one that we were just talking about, collaboration among key stakeholders, making sure that state agencies are talking, both CCDF agencies, state education agencies, and other related agencies. Making sure that state after-school networks are talking to state alliances, to city intermediaries, and everyone working together to really increase supply, quality, and access. targeting school-age funding based on identified gaps and priorities in communities. This is really about that effort to do a needs assessment and identify who we most want to serve and making sure that we're targeting our public dollars in that direction. And then finally, making sure that we're connecting with the state advisory councils and that state leaders include out-of-school time, giving them a seat at that table so that as policies are being developed, we're taking into account what is happening out there for families, for providers of school-age children. And with that, I want to turn the final words over to Kathy for wrap-up.
Thank you, Susan, and I see we are just about on the hour, so I want to remind folks that you are going to be receiving a short evaluation. I'm going to urge you to complete that so that we can continue to get feedback from you and bring ideas to us of things that we can help you with. And want to thank in particular Susan O'Connor and Bob Frein for sharing this time with us and sharing all the good ideas that you have showcased. And we hope that the folks attending have both gotten some good ideas and information that will be useful to you. And when you'd like to look back on this content, it will be put up onto our new website, and you'll be able to find it there. And of course, you'll also want to check out our new library, which is about to come live. So I want to thank everyone for your attendance today, and we look forward to connecting with you again on another topic in the future. Thank you so much.